Question number 1. A patient has been taking Statin and reports to you that they are experiencing soreness and weakness of the muscles. The healthcare provider orders lab investigation. What lab result below require immediate nursing action? Options: Option A, increased creatine kinase level, B, decreased creatine kinase level, C, decreased low density lipoprotein level, and D, increased high density lipoprotein level. So here the right answer is option A, increased creatine kinase level. So statins have a risk of causing statin-induced rhabdomyolysis. This is a breakdown of skeletal muscle. If a patient reports muscle soreness or weakness while taking a statin, the CK levels should be measured. So this is a protein found in skeletal muscle. If a skeletal muscle is breaking down, CK will be found in the blood in high amounts. And this tells us there is a muscle damage. If this occurs, the statin should be discontinued by the patient. Question number 2. A newborn with a diagnosis of developmental dysplasia of the hip is using a Paulich harness as treatment. The nurse is giving health education to the parent about care for a newborn. Which of the following should be included in teaching? Options: Option A, put the baby diaper over the harness. Apply lotion to reduce the skin irritation. C, bath the infant with a Paulich harness. And D, follow up to clinic every 12 weeks. So here the right answer is option D, follow up to clinic every 12 weeks. So it is important for monitoring the progress of treatment and ensuring that the Paulich harness is adjusted as needed to effectively treat the developmental dysplasia of the baby. So regular follow-up appointments allow the healthcare providers to assess the infant's hip development, monitor the fit and effectiveness of the harness, and make any necessary adjustment to the treatment plan. Question number 3. The nurse is performing physical examination of a primary gravida client who is 8 weeks pregnant. At this time, the nurse expects to assess options: Option A, Head signs, B, fetal outline, C, ballotment, and D, quickening. So here the right answer is option A, Head signs. So Head signs is a softening of the lower uterine segment which is palpable during the bimanual examination. It typically becomes noticeable around the 6 to 8 week of gestation. The other options such as fetal outline, ballotment, and quickening are typically assessed later in pregnancy. Question number 4. During an nursing assessment on a patient with a pressure injury, you note that the patient pressure ulcer has a loss of dermis with fat showing, but no muscle, tendon, or bone showing. Which pressure ulcer stage is this? Options: Option A, stage 1, B, stage 2, C, stage 3, and D, stage 4. So here the right answer is option C, stage 3. So stage 3 injuries have a loss of dermis with fat visible, but no bone, muscle, or tendon visible. In stage 4 sees a loss of dermis with fat and muscle, bone, or tendon visible. Stage 1 sees the skin intact with no blanchable redness, and in stage 2 has a partial loss of dermis, often with a pink wound but no fat or muscle or tendon visible. Question number 5. A 6-month-old infant lens became opaque. The child is diagnosed with cataract. The nurse knows cataract may affect options: Option A, 1 in 1000 newborns, B, 1 in 250 newborns, C, 1 in 4 newborns, and D, 1 in 20 newborns. So here the right answer is option B, 1 in 250 newborns. So the cataract in infants known as congenital cataracts are relatively rare but can occur. The estimated incidence of congenital cataract is around 1 in 250 newborns. These cataracts may be present at birth or develop shortly after birth, and they require prompt evaluation and management, or it will be leads to blindness. Question number 6. Which of the following phases of the first stage of labor are contractions generally mild or moderate? Options: Option A, active, B, latent, C, transition, and D, none of these. So here the right answer is option B, latent. During the latent phase of the first stage of the labor, contractions are typically mild to moderate in intensity. This phase is characterized by the onset of regular contractions, cervical dilation up to about 3 to 4 cm, and usually lasts the longest of the 3 phases of the first stage. So as labor progresses into the active phase, contractions become stronger and more frequent and cervical dilation accelerates. So finally, during the transition phase, contractions reach their peak intensity and the cervix dilates fully in preparation for the second stage of labor. Question number 7. Which diuretic below can lead to hyperkalemia? Options. Option A. Metaloxone, B. Torsemide, C. Hydrochlorothiazide and D. Amiloride. So here the right answer is option D. Amiloride. So this is a potassium sparing diuretic. It inhibits the sodium reabsorption which affect how the nephrons manages potassium. So it will causes the nephron to decrease the potassium excretion, so which leaves more in the blood. So this could lead to hyperkalemia. Metaloxone and hydrochlorothiazide are a thiazide diuretics which could lead to hypokalemia. Torsemide is a loop diuretic and it can also lead to hypokalemia. Question number 8. The nurse is assessing a patient medication history. The patient has been prescribed a macrolide for the treatment of otitis media. Which medication below is a macrolide? Options. Option A. Streptomycin, B. Levofloxacin, C. Neomycin and D. Azithromycin. So here the right answer is option D. Azithromycin. So azithromycin is a macrolide that can be prescribed in children to treat a middle ear infection. That is nothing but is called as otitis media. Streptomycin and neomycin are aminoglycosides and levofloxacin is a fluoroquinolones. Question number 9. A client has complaints of wart-like lesions on the vulva, painful wrist and finger joints and chronic hoarse throat. Which of the following is the most appropriate treatment for this condition? Options. Option A. Penicillin G IM, B. Acyclovir per oral, C. Ceftriaxone IM and D. Azithromycin per oral. So here the right answer is option A. Penicillin G IM. So if the patient is presenting with symptoms indicative of syphilis such as genital warts, painful wrist and finger joints. That in this painful wrist and finger joints, that is indicative of secondary syphilis and a chronic and hoarse sore throat, then treatment with penicillin G IM would be appropriate. So penicillin is the first line treatment for syphilis at all stages of the disease. Question number 10. A 72-year-old woman is admitted to the neurosurgery ward after a fall resulting in a head injury. She complains of right hip pain and vital signs shows instability. What nursing diagnosis should be focused on first? Options. Option A. Risk for fall and injury due to sterility. B. Self-care deficit due to weakness. C. Risk for altered consciousness due to head injury. And D. Hypothermia due to injury response and infection. So here the right answer is option C. Risk for altered consciousness due to head injury. The risk of altered consciousness, that is a priority due to the head injury, and vital signs abnormalities indicating potential intracranial complications. Question number 11. Which of the following defense mechanism is expressed by overachieving in one area to make up for lack in another area? Options. Option A. Compensation, B. Displacement, C. Suppression and D. Repression. So here the right answer is option A. Compensation. So compensation is a defense mechanism where individuals overachieve in one area to compensate for perceived deficiencies in another. So it allows them to bolster self-esteem or cope with feeling of inadequacy by excelling in a different domain. So this mechanism helps to maintain a sense of competence and control despite shortcomings in specific areas. Question number 12. A client with stomachization disorder visits multiple physicians for various vague symptoms involving many body symptoms. Which nursing diagnosis takes priority? Options. Option A. Risk for injury related to treatment from multiple physicians. B. Anxiety related to unexplained multiple somatic symptoms. C. Ineffective coping related to psychosocial distress. And D. Ineffective health maintenance due to excessive doctor visits. So here the right answer is option B. Anxiety related to unexplained multiple somatic symptoms. So anxiety related to unexplained symptoms is a priority in clients with somatization. disorder to address distress and manage the care effectively. Question number 13. A 4-year-old child is admitted to your unit with a severe case of impetigo. It is important the nurse should follow which type of precaution while providing care to the patient. Options: option A, airborne precaution, B, contact precaution, C, standard precautions only, and D, droplet precaution. So here the right answer is option B, contact precaution. The nurse will follow contact precautions, which includes following standard precautions as well. Impetigo is a highly contagious skin infection spread through direct contact with the source and discharge from the infected patient. So the nurse should always wear a gown and gloves when providing care to the patient to prevent transmission of the infection. So the droplet and airborne precautions are not necessary because the bacteria are not spread through respiratory droplet or the air.